Cool. So yeah, it's recording. How are you doing, man?
Right, you're looking like a surfer.
When in Hawaii, do as the Hawaiians do, right? Dude,
Right.
I started to grow it out, and then I tied it up one time when I was going out to the beach, and I burnt the hell out of the back of the neck. So now I'm stuck with it. I can't cut it off because now I'll fry whenever I go out surfing or diving. So I'm stuck with long
Some
hair for the time being.
Hey, no need for anything else. It's no barbers anyway.
Right? Nowhere's closed. And that's why I was excited to bring you on. There's your son. Your kids are huge.
I know. Big. That's right. You haven't been here for a long time, huh?
No, it's been a couple of years since I was up there when we tried hiking Shasta the last time. That's awesome. Yeah, he was a little guy when I was there last time.
Yeah.
So, how was Easter, man? Was it good?
It was good. We just chilled, ate a lot of good food, and nice weather here. We were out kayaking on the swimming pool and goofing off. I don't know. It was all right.
Nice. So I was excited to have you on because obviously I've been wanting to start this podcast because there's so much information out there, right? And you have
Yeah.
a really unique perspective. I don't want to slaughter your job title. What is it exactly you do? I know you're a nurse, but what department? What nurse?
Now now I'm an assistant manager in the PACU, which is the Post-Anesthesia Care Unit. So we pre-op everyone before they go into surgery, and then we take care of them after surgeries.
Okay.
And they can, I'm inpatient, so we do some outpatient surgeries, but we also do anyone that's critical from the ICU comes over to us for an emergent surgery. They kind of get prioritized, and then we take care of them and then put them back in the ICU.
So what?
So
Yeah, sorry to cut you off. Keep going, man.
no. So we're all of everyone in our area is critically trained, either emergency room or ICU experience.
Okay, cool. So you obviously have seen or will see some of the coronavirus patients that roll through.
Yeah, yeah. And the emergency planning for our hospital is there's 20 ICU beds, and so once that's filled up, then our nurses will start assuming care of COVID patients.
Okay.
That's the most recent. The plans have changed multiple times. As of right now,
Of course.
and it's almost daily. But the current plan is for us to start taking care of vented patients as the overflows open up and as they get inundated and can't handle the capacity.
So let me ask you this. How full are those 20 beds? Are there still people rolling through, or are they close to maximum facility, or?
Not at all. We are at the lowest census our hospital has been in years for this time of the year.
Really?
We have we have 3 ICU COVID patients. As of the last day I was in there a few days ago, there were 9 total COVID patients. It was 3 and 3 on med surg, 3 on the telemetry, and 3 in the ICU. So we had some that weren't very critical, some that were could go either way, and then you had the critical ones.
What the ones that you're seeing that are getting to that critical place, what is if there is a major factor, or what's leading to them being to there rather than the ones that recover, never even see the hospital? Is there a determining factor, or is it kind of up in the air?
We have had so few patients that it'd be hard for me to say for sure what determining factors. What I have seen and heard from the patients we do have, one was elderly, one was in and out of homeless, had alcohol, substance abuse, diabetic, and methamphetamine use. So he was our youngest one that got hit hard, but he was not in good health. And then the other one was a little older, upper 50s.
Okay.
And I'm not sure the health history on that one.
Okay,
so,
cool.
Yeah, as you can see, we just haven't had enough experience yet to see it. And I do know the only young person that's gotten hit hard would probably get hit hard with a lot of different things if they got hit with a flu even.
Yeah,
So
yeah. I mean, homeless with drug history and diabetes and everything else. And that's what I've heard is from a lot of people that I've been talking to is diabetes seems to be one of those triggering factors that if you are diabetic, you're one of the ones that needs to be protected because of the possibility of it getting a lot worse
yeah,
than normal symptoms, right?
yeah, I'm hearing hypertension, obesity, diabetes are big ones. They have a lot of theory behind those. I've read the most recent one with the COVID, some being going through the red blood cells. So it's not as much that it triggers, it just goes to the lungs. It's actually more of a red blood cell thing, and then as the red blood cells get hurt or damaged, and they release that cytokine, and it releases the iron, and then it hits the lungs. That's what's doing the damage to the lungs. I heard that it makes sense with the type of people. Like when you think about a diabetic or someone with hypertension or obesity, that theory could make sense.
So, while we're on the hospitals, I know that that's how I got to know you, obviously, as we lived in Italy together and spent a lot of time in Italy. And that's one of the things that the U.S. reacted because of some of the findings that they were finding over in Italy. And when I talk to people about Italy, I can speak to the culture of Italy and why I think that it ran through the Italian population so quick and harsh with the way that they all share so common of spaces, that very few people have a car. They spend a lot of time on subways, on trams, on buses. They don't just shop once a week and buy everything. They leave every day to go down to the bread store or the meat store or the cheese store. And so everybody from a community shares very tight locations. They speak a lot closer than us Americans, kiss each other on the cheek. They all go down to the
Mhm.
palazzo to walk around and kiss their neighbors every night. Some of those things
Yeah.
are really fascinating to me. And I wish we had more of them in the American culture, but I also think that that's a lot of the reason why the disease was it was so contagious over there. So many people got it, but the mortality rate was also 10 times what it is in the US. Obviously, we have more deaths than them, but we have 10 times the population. Um,
Mhm.
so that's the mortality rate over there was so low. And I only spent a few days in hospitals, once when I injured my own foot and when I spent time with another kid in there, but I'm not a medical professional now. And so seeing 8 people to a room and chasing the cat out of the hospital on our way in, and the smoking
Yeah.
in the hospital, those are things that I experienced, but then I haven't transitioned over to be part of the medical field now. And so for your expertise, them as a country, are there some, is it obvious to you why it it was more deadly over there?
It's not surprising at all. And I had the same, that's funny, I had the same experiences in the hospital with cats coming in and out of the hospital, and also with the smoking. And so I've heard people in the media, and also the nurses that I work with, say, well, Northern Italy has some of the best hospitals, they're very advanced. Compared to who? Compared to Southern Italy?
Right.
Probably.
Right.
Hey, dude. Compared to us, no, not a chance. Our hospitals are more advanced. They're better. We're better equipped. Education wise, they have some very educated people, but equipment, materials, resources, we have serious advantages here. I think the other thing that you touched on, with the close proximity, and you think about it being Northern Italy specifically, where they have the subways. Milan has the subways. Bergamo has the trains in Milan. They all use those things. Those cities, they got. I've spoken to some Italians, and these pockets where you're right. They all congregate, where they all touch the same citofono, the same buttons to get into the buildings.
Right.
I mean, you think about those things just alone. One story I know out of Vercelli, which is right in between Turin and Milan, which is that northern Italian area. 10 people died on one small street there, and that sounded devastating to me. And then so I started asking questions. All 10 of them were over 80 years old. All 10 of them were in pretty poor health, and all 10 of them hung out. And so when one of them got it, they all got it, and then that was it. It's very sad, but it's also very, it'd be the same as a bad flu going around. You have to be pretty careful with those things.
Right. And that's when I've looked at their findings for the flu season, obviously this is more contagious and more deadly than the flu. I'm not arguing that, but they have some pretty devastating flu seasons as well. When people start getting sick, it just gets to be devastating. And the older population, they're old. I mean, that's one of the things that I first noticed when I landed in Italy. My first experience was in Italy was when I got to Como, walking down the street, and it was that epic cobblestone street. But the amount of old people around playing boccia and just sitting on the street bench and talking and smoking, it seemed like almost everybody over there smoked, and especially the older generation. I don't know if I know one that didn't smoke. I mean, that's the older generation. They all smoked.
Well, think about this. When we were there, they were all in their 60s, right? This generation we're talking about now,
Right.
they were in their 60s, maybe 70, somewhere in there, but you know, upper 50s through 70. You're right. They all either smoked or had smoked or lived with smokers or hung out in those same places with heavy smokers. And so all of them have some sort of lung deficiency probably because of that, for years and years of that. No, absolutely. And you're right. I've heard either they're the oldest country on the planet age-wise, or Japan is, but they're one of the oldest.
Right.
And so yeah. I mean, they are the perfect storm for something like this.
So speaking of Italy, they had, and this was a question that one of my buddies wanted me to ask you. They've got protocol over in Italy for if you're over a certain age or certain health detriments, a triage experience, right? Very similar to war because of their lack of goods and the amount of sick. They're picking who gets some and who doesn't. Like if you walked up on a bad car wreck, who do I give my services to first? Do you guys have a protocol in place? If it gets to that point where you start having to decide who gets a vent and who doesn't, how do you make that decision?
That's a really good question. And so America's different in healthcare. We're not socialized, so it's more individualized. So it's up to the individual. So if you want to be saved, if you choose to be saved, and you're 90 years old, and you come in through the door and get that vent before the 35-year-old, that's how it works. However, it's also, you know, we typically try to use some rationale with the family members or someone like that, and let them know that at some point it's futile, right? That's a word we like to be honest with people and go, you know, if a 90-year-old with COVID gets it and they're intubated, their chances of getting off that life support is very, very low. And so usually you kind of, I mean, my experience with H1N1, for example, and some of the other flus that have gone through, and I'm taking care of a patient and they're in the ICU, and you look at the lungs on an X-ray, it's all whited out, and you're looking at the numbers. They're on medications plus the vent to keep them alive, and they're elderly. It's just such a bad chance. And even if they recover, their health is going to be so poor. There's a very strong likelihood that they'll die from complications of that, or get reintubated and go through it all over again until they just basically diminish. And so we try to talk to families and usually have pretty good success getting them off the vents, and then we can move to a younger person. Now, our hospital right now, just put this in perspective, we have now I think we only have 2 intubated COVID patients. We have capacity and have prepared for 80. We could have 80 people on life support. And right now we only have 2 intubated from COVID and a few other intubated. And so, you know, capacity wise, we have capacity to handle a lot for this community. And we're one of the 3 hospitals that could do that in our small town area.
So that's interesting to me, because I hear these stories of New York, right? Just lines out the street. Why don't they? But then I also read, and I'm not in the medical field, and so I don't understand this, but the USNF, one of the big boat over there, only had 20 patients. They had the possibility to have 100 in New York. What is the problem that they're not sharing in the disaster, like sending some of them? You know, 9/11 happened and New York all came together, and it seemed like everybody really helped each other out. But now this is happening, and it kind of seems like the federal government is separate from the hospitals, is separate from the state, and they're all separate from each other, just throwing their hands up in the air and saying, you guys deal with it. I'm sorry that it sucks for you. Is there a problem there, or what is it?
Yeah, the problem is the billing, I think. I mean, how do you quantitate this, right? Who pays for what? Because before it was all, we had these private hospitals, and you kind of fend for yourself, and like if your hospital's not prepared, like I worked at a small town hospital, right? And when H1N1 came and we went to the point where we were overflowing and didn't have capacity, we sent people down the hill. That's what we call it, because we were up on the mountain,
Okay.
and then sent them to the big hospitals that had the capacity. So, they took on more patients and presumably, billed the patients for it. And so it was kind of, handled that way. Like if you were prepared and you could do it, then you got the billing for it, right? And so with this, it's a little more complicated because they needed to figure out how to share the vents, how to share, like, oh, this pocket, this pocket's getting hit hard. We don't have enough vents. We need to get vents from these private hospitals that aren't used to doing that and move them over here. And so I think that's caused a challenge. I've listened to those interviews with Cuomo, and it sounds like they figured it out, but it was a little too late for some of the stories.
So it's
That's not the only challenge, though, Josh.
Of course. I mean, there's going to be just location. New York is built very much like Italy, where you're going to get hit hard in an apartment complex or other things.
Mhm.
And I'm sure there are other problems, other challenges inside of the medical field, but it's interesting to me that one of those is economic, when they're shutting down the world economics. But the problem with the hospitals is also an economic situation. It just seems, and I've caught a lot of crap, admittedly, on my posts and everything else. I've caught a lot of shit from people that are coming at me because I talk about this being about money, when
Mm-hmm.
economy to me is so much greater than money. And it's interesting watching that even infiltrate into the medical field, and decisions are made on money. And obviously, if you don't have the money to buy the masks, the vents, the beds, or anything else, you don't have them. And so it's a really interesting situation that we've kind of stepped into.
I'll be honest with you now that you've said that. I'm having more anxiety at this point in a lot of ways on how to deal with the aftermath of the economic downfall than the actual COVID. We're gonna be dealing with domestic violence problems. We've already dealt with some suicide stuff in our community, and I'm positive alcoholism is going to be something that we're going to be dealing with. Which we dealt with in 2008. We dealt with I remember dealing with a lot of the alcoholism from the stories of people that lost their jobs, and then they're depressed, and then they just sit around and drink for months, and then end up with the problems and complications from alcoholism. So there's more to this, problem wise, as this goes on with our economic decisions than just who can afford the mask.
Well, that's, and you brought up something interesting to me, is you were overflowing during H1N1. I didn't know that. I didn't know that you guys were buried in H1N1. So you were overflowing in H1N1, which, if you compare the sicknesses, everybody's saying that this is so much more contagious and everything, but in your specific community, you're recognizing the opposite, at least right now. Who knows where this gets to, but right now, H1N1.
Yeah, this one seems more contagious and goes through people fast, and it's more unpredictable. So I think it's much more scary. But keep in mind, with H1N1, the majority of the people affected, the majority of people that died and were hit hard from it were 65 years and younger. We were taking care of a lot of patients in their 40s and 50s. And some of them died, and it was very, very sad having their children at the bedside. Where this one, the majority of it is 80 and over, 70 and over. So it's hitting harder and faster, but it's to a population that is at a different point in their life too.
Right. They've already, to me, and I'll say this, I don't know if it'll get you in trouble. I will. When I read the obituaries and I see a 78 or an 82 or an 84-year-old die, my immediate thought process is they lived a long life. They're not doing, they're not creating new experiences, not creating families. They're not doing a lot of things. They know they're on the last quarter of their life. They're planning for it. They know that they might only have a few years left, that anything could take them out. They've got their kids, their grandkids, their families, their experiences, and they're planning for death. A lot of them are okay with it. And I haven't seen a lot of people die, just a handful of people. But those ones that I have, they they were okay with it. They had come to grips with death and were okay with that. And I think that that's why when I look at this, I'm not terrified by it, is because I'm kind of okay. I don't look at death as a horrible thing. Death is a passage for me. And so I don't look at it as a
Right.
horrible thing. But if this were a 7-year-old or a 12-year-old that was on, I think that we'd have to look at it different as a society than taking out those that are maybe okay with death.
And you know, I have to be careful what I say on this subject. I will say this first on what you just said. I think the positive on this is it is very good practice for if we ever do have something that affects, you know, 17 years old and younger people. Let's just flip the numbers. Let's say that the majority of the people dying from this and getting hit hard were, you know, 0 to 9-year-olds, and then the next biggest class was, you know, 10 to 17-year-olds. That to me would justify very much what we're doing here, like an isolation and maybe even more seriously. Speaking of serious. Now, as far as my feelings on death, technically in the hospital, we are to treat everyone by their wishes, what they want. So an 80-year-old could be totally equal with a 33-year-old, just with their desires of you know, we call it full code, full court press, do whatever it takes. My experience, however, like yours, I will say this. When someone has, and I've dealt with a lot of people dying when I worked in the ICU, when someone dies in their 80s, in their late 70s, it's more of a you know, as they pass, the family's kind of reflecting on their life in a way that's more joyful. And you know, they can come to terms with it pretty easy. I haven't seen any that, you know, run out of the room screaming and crying. Where on the other hand, when someone young dies, like one of my H1N1, I lost a mother, and her teenage daughter was at the bedside. And when she died, I watched that daughter and scream in the hospital, and she was just in hysteria. And that's more the effect of it. That's the reality of someone younger dying versus someone older. They're just, you're right. They're in my experience is a difference.
That's you know, some people look at death differently, and that's why I want to touch on it light, because I don't want to diminish anybody's life, right? But at the same time, somebody that has a long time to live, to me, is different than somebody that's already lived. You know, if I heard that my parents were sick from this, or I heard that my daughter was sick from it, the thought process would be different from my parents having it and having kids and grandkids and those experiences, from my daughter going, man, she hasn't had any of that yet. And so, yeah, I think I would react differently. Even close to home, I'd react differently from my daughter to my parents on how I would react. But you, the isolation and the seclusion and everything that we're going through right now, let's assume that it is another pandemic and it is a younger generation. How do you exit that? How do we exit the one that we're in, and how do you exit that other one to where you do save as many lives? Because if 80% of the population, as math has it, if 80% of the population is isolated right now, as soon as we open the doors, we're going to be right in the same crisis that we're trying to avoid, if I'm not mistaken, right? So how do they exit this?
They're trying to figure that out right now. I have my opinions on it. If you want to hear an opinion, this is not, you know, I'm not saying this is right, but I like the Sweden model. I like the idea of a herd immunity. We know the people that get hit very hard, and we know the people that are more safe. And so for me, I think it'd be the first steps would be reintroducing younger, healthy people and letting them get the COVID. Show me any stat. I mean, you have a safer stat of, you know, for those young, healthy people of getting COVID and recovering and being just fine than you do, you know, riding a motorcycle or even, you know, taking some drives into the city a few times is kind of a Russian roulette compared to a young person getting COVID. So I think that would be the first step. I think, you know, Sweden's model of kind of trying to create a herd immunity and then letting the more vulnerable population back out is we're going to have to try something along those lines. And there's going to be some lines drawn and some tough decisions on it. But at some point, because from my understanding, we're still a long ways away from a vaccine. Vaccines take a lot of steps before they become safe, and right. A lot of testing. So it's I know there's a race for it, but it's still quite a ways away.
Well, HIV, another virus, we didn't find and we're a lot much more technological now, but they didn't find a vaccine for decades. And so SARS-1, we don't still have a vaccine for today. And so who knows if they even find it? I mean, with the technology and the amount of hands and money being spent on this, I would expect them to find one, but it's not
I
a
would
given that
expect.
it's in weeks or months.
No, not at all. Not at all. And we're going to have to make those decisions. We're going to have to realize that it's okay. We can't live in caves for the rest of our lives. We are going to have to reintroduce ourselves into society. We're going to have to let young people start living again, and let their livelihoods be something that's important. We've
Yeah.
put livelihoods to the side right now, and it's starting to hurt really bad. So
It's crushing some people. I've already read of a couple suicides, and so I'm starting to see what I've been afraid of, because I went through the 2008 crash, and
yeah,
me emotionally, I went through those suicidal thoughts, and because I put a lot of my wealth, some of it was my fault. I put a lot of my value on how much money I was making and my investments, and when they started to crash, my own self-value crashed. So a lot of that was
yeah,
self-imposed. But the people that were just a few years younger than me, they're going to be going through the same thing now when this crash happens. So
absolutely.
I fear for those friends of mine that are just a little bit younger, and my kids and those that haven't been through this yet, what they're going to be
Yeah.
going through emotionally. So tell me about the anti-malaria drug that they're trying. How effective has that been?
So, like the people in the ICU, we don't have tons of experience, but we do have more stories with that. So they've started doing that with the Z-Pack on the floors. And I spoke to an assistant manager on our med surge floor, and they're the ones that take care of the people on the lower end that aren't getting hit. They're hit hard enough that they need oxygen and they're in a hospital, and we're monitoring them, but they're not being hit hard enough that we feel like it's affecting their heart enough to monitor their heart, or you're right on the verge of having to get a tube down their throat to be breathing for them. They're not quite there yet, right? They could go either way.
Right.
Um, he said to me, was not a single one of them. They've been on those meds. Not a single one of them has escalated care, which means not a single one of them has gotten worse, and multiple ones have gone home. And so that's our experience so far with that.
So anecdotal evidence says that it works. Who knows what the science will say, but anecdotally.
So far, that's what it looks like.
Interesting.
Yeah.
That's
Yep.
that's really, I mean, you've really, and I've had a lot of conversations with you, but I kind of wanted to get your opinion on this for other people. I'm calling so many different people out there, nurses, doctors, the people that are seeing this up front. And it's interesting that everybody has a different opinion, even with the same experiences. And maybe that's their perspective. I don't know, but your opinion is super valuable to me because I also know your thought process and I've known you for a long time. So
Well,
what,
thanks, Josh.
if you wanted to get anything else out there, any other information out, what would that be? What would you make sure that people knew, if you have anything?
I think one of the most important things now that I've watched, and exactly what you said, I find it fascinating that me, with my education and my career, sharing the same education and same career as lots of other coworkers, and they've come to different not only conclusions, but these anxiety-driven fears, and they let that take hold of them and kind of run their lives. I'm seeing people come into work and they're shaky and the bloodshot eyes, and in their head, every patient somehow has COVID because they look at just they get so tunnel vision. They look at the white blood cell count's elevated. This person has an infection. They must have COVID. When we already know the reason they're in for surgery is their pancreas or a kidney or something that's causing that. And for me, it's very obvious that that's the reason. But people let their fears and anxieties get a hold of them to where their thought process isn't necessarily healthy. It becomes this fear, and it just grips them. And I for one would hate to live life that way. I feel bad for someone that lets that happen to them. These hypothetical worst case scenarios in their heads. I think the media has been a little aggressive on some of the stuff they've reported. I want to say if it has accuracy to it, it also has a lot of exaggerations. I mean, they certainly, a lot of them are pinpointing these worst stories, right? And they're leaving things out, you know. Oh, um, this person died that was young or whatever, and it was the worst thing, and we couldn't see it coming. When if you really dug into it, I wouldn't be surprised if they had underlying health problems.
Right.
So
And even seemingly the people that I know that have gotten really sick, or the stories that I've heard, when they say that they're in good health and have no underlying health conditions, when you start asking questions, they're on anti-inflammatories for this, or they're on a medicine for that. They're on something. And that's just society nowadays, is so few of us are just living healthy lifestyles, which I don't want to take too much more of your time and extends too long, but that's one of the things that I'm seeing. And tell me, as a medical professional, the measures that we're taking to try and protect us from this. We're taking otherwise healthy people. I've heard that vitamin D is really important for fighting bacteria, vitamin A, good diets, good exercise. And of course, a sane mind is really important to this. We're taking people, locking them indoors, ruining their mental health or diminishing their mental health. They sit around and eat Twinkies and Ho-Hos and Fritos all day long, increasing their sugar intake, decreasing their health intake. They're not getting sunlight anymore. They're cardiovascularly, they're hurting. And then they're laying prone, which in the past, laying down a lot and being very sedentary causes lung problems. So now you have an upper respiratory virus that is attacking lungs. To me, it seems counterintuitive to building up a good immune system and a society that's immune to a virus. Touch on that.
Josh, do you remember when this first started spreading and some of the first people noticed were athletes? Do you
Yeah.
remember that?
Yeah, Donovan Mitchell, Rudy Gobert. Yeah.
I mean, I follow Juventus. So when my Juventus midfield and Paulo Dybala got it, I was watching, right? And then you watch their tweets and they're fine. They're fine. They're like, oh, man, this is weird. Like I had like a little achy, or I was a little weak for a day. Now I'm fine. Hey, I'm just gonna wait 2 weeks. I'll see you guys in 2 weeks. All athletes, that was the same story. Every single one I heard was something along that spectrum right there. Well, that's because they're exercising, just like you said. That's because they're beacons of health, right? And so they handled the COVID, went through those athletes like it was nothing, and now they have immunity. And then I hear these stories of Southern California, how they're not letting people go surf because one person came up with a fear theory that aerosolized COVID blowing through the wind from the water could hit people on the beach or whatever and make them all get sick. It was the most ridiculous thing I've honestly ever heard. And I can't believe society bought into that one. I am shocked. I think people should be out there surfing. It's good for their lungs. And it's good for their health, and it's the sunshine. I absolutely am appalled at whoever made that decision. And then the thing with this, and you know this too, when you're doing a lot of sports, let's say you're a young surfer and you're surfing all the time, what's your diet? You're taking in all those calories. You need all those calories, so you're eating kind of crappy food overall. But for them, it's fine until they stop the surfing, and then
they're still eating.
And then they're still eating because that's their habit, and that's what they're used to craving or whatever. And then they start getting obese or whatever and having problems from that. It's insane.
Yeah, it's crazy too. That's why when we get done here, they say that you're not supposed to, but I'm going to hit in the water and diving because I believe there's some constitutional problems with this, and I'll have a constitutionalist on here to ask him if they can take otherwise healthy, unexposed people and lock them indoors and deprive them of things like exercise and good food. But sooner or later, everybody's going to be on economic assistance and eating the cheapest food in the grocery store rather than the fruits and vegetables and those things that really give you are nutrient dense. They're going to be eating crap because that's all they can afford, ramen noodles and mac and cheese. But yeah, I'm going to go maybe surf, or the wind picked up, so the wind waves are choppy, but I'm at least going to go dive and go grocery shop 60 feet under the surface.
Well, that's perfect. And once they lift some of these bans, hopefully I can come join you.
Dude, come on over. There's the mahi are in, the ahi tuna. I saw some yesterday, but yeah, the mahi are out there. Some wahoo are in. Pretty sharky waters, but the waves are good and there's nobody on them. That's the best part about them is I'm the only guy on the beach. So
that sounds perfect.
So cool, Dan. Well, I appreciate you jumping on. Maybe have you on another time, and I'll give you a call in the next day or two, and we'll chop it up some more.
All right, Buck. Take care, man.
You too, man. Come on over to Hawaii. We'll see you soon.
We will. It'll be soon.
All right, cool, man. See you, bro. Thanks, Dan. See
Bye,
you. Have a
Dad.
good day, buddy. You've been the best guest ever. See ya.
Yeah. Yeah, the absolute best. All right, man.
See you, man. Have a good one.
Goodbye.
Bye.
Goodbye.